are there preventative measures that a parent can take
Yes.
to stop a kid's teeth from getting crooked?
Yes and no. One is getting the teeth removed at the correct time. You find that their teeth start falling out, the baby teeth, the milk teeth, start falling out sometimes at age between 4 and 5. So what you find is that parents need to know when is a baby tooth of the child shaking. If it's shaking and it is not removed at that point, the tooth that was coming in there normally sometimes changes direction and comes behind that.
So it grows behind the milk tooth.
The milk tooth.
I see.
So that you find now, even when they come and I remove the baby tooth, the other tooth already is out of line, which means chances are that we will end up doing braces for that child. But if the parent was keen, especially from age around 4 or 5, checking that is my child tooth shaking or something like that, and help the child remove the tooth at home. And if they are not able to do that, visit the dentist for that tooth. Then you find that the other tooth will come in straight where it is supposed to be. So that is one thing that the parent can actually do. The other one is if they notice the jaw is a bit small or the teeth are not fitting as much, then going to the dentist. Because either the dentist can decide I'm removing a tooth here to let these other ones align properly as they come in, or they are doing a more preventive treatment, like what we call interceptive orthodontics, when the child is slightly young. So that is some of the things that the parent can do sometimes to end up helping. There is a genetic component to the teeth becoming crooked. That genetic component is determined by the size of the jaws and also the size of the teeth. You will find that there are some people, their family, you'll find almost everybody, the teeth are crooked or are crowded because they probably have very small jaws. So when the teeth come in, they can't fit. So in that scenario, then the parent probably has not much control over that. Yeah, and actually majority of the crowding of the teeth would fall into that aspect of genetics. Yes.
Okay. Now this one is something that I have just heard of, like sucking of the thumb,
Yes.
such things. Do those impact the way the teeth are formed too?
Well, yeah, thank you for asking that. I probably have also forgotten about that. Yeah, some of those habits, of course, tend to affect the way the teeth come in. And thumb sucking is a major one because when the child is either sucking the thumb or the fingers, what they tend to do is that over time, because the bone is very soft, they actually push with the thumb. Slowly, they redirect how the jaw, the upper jaw grows. So instead of the upper jaw growing in whichever direction is very straight, the upper jaw is actually pushed forward so that when now the teeth come in, they will actually be protruding forward out of the mouth. So you find children who have had their thumb sucking, the teeth will be protruding out, and then they will also push the palate up so that instead of the roof of the mouth being like U-shaped, like this, you find it's almost like a V-shaped. Yeah, they have pushed it until it's reshaped the bone. So then you find that at the back, the jaw is smaller, at the front, it's been pushed out. In a scenario like that, it would be good to go to the dentist early and help the child because we can do what we call a habit breaker. We can give the child a habit breaker, and that would help stop the thumb sucking. Yes.
I, for one, am not familiar with habit breakers.
Yes.
I've only read it somewhere, actually, on your website.
Yes.
But I do not know what it is.
Yes.
Maybe before we move to the next question, if you could just simply break that down for the layman.
Yes.
That's watching.
The habit breaker, basically, what you're doing, you talk with the child, you show the child what the habit is doing, but they are not able to stop by themselves because probably they normally suck when they are idle, watching television or sleeping and something like that. But they can definitely see that it's making their teeth not look straight. So they would also probably like to stop, but they are unable to. So when you explain to them that and you ask them, would you like me to help and give you something to remind you? It is not a punishment because when parents do it at home, they use all these forms of things. They beat the child, they put pepper, pinching and all that. It's like form of a punishment. But how we approach it in the dental office, we are working with the child asking them, would you like us to help you? We are going to put something in your mouth which will be reminding you.
Don't do this.
Yes, we are not punishing you. So there can be a removable habit breaker or a fixed habit breaker. When the child is a bit slightly older, around age 8, and they already can understand and can take care of that, we can give them a habit breaker. It's just a simple plate which goes on the upper part of the mouth and supported by the back teeth there. But then it has a small wire at the front, a zigzag wire like this. It's not for poking, we tell the children. This is not for poking your thumb when you're there. It is simply just when you put your thumb there, it is just to it reminds you that you're not. Because why children who thumb suck, it is very soothing. When they put their thumb next to the palate, it is normally very soothing. So what you're doing is just remind, every time they put it, oh, we agreed with the doctor that I shouldn't suck, then they remove. Yes, even at night, because now there is no contact with the palate, there is something else, then
it's not as soothing. It is the same sensation is not there anymore.
Exactly. And within 3 to 4 weeks, we've seen many of the children, the habit breaks and we remove it. But then if the children are slightly younger, they will not be able to wear the removable one. So we normally take the measurements of the mouth. We ask the lab to fabricate something almost close to the same. It can be like metallic. We cement it on the back tooth, but it also has the same thing at the front, just to act as a habit breaker.
And that one is not removable? That one until maybe they are of a certain age? Huh?
No, we will normally still keep it for a short time.
Okay.
Yes, we will work with the parent. The parent says, these days, I visit the bedroom at night. There is nothing there. After 2 months, we remove it. Yes,
okay.
we remove it.
Okay.
And rarely do the children go back.
Yes. That's good.
Yeah.